Hey guys, so this video is long overdue. This is the findings for my CT scan. CT with contrast dye, so they injected me with dye beforehand to basically light everything up in my internal organs and show everything more clearly. So this was a CT urogram, which basically shows the bladder and kidneys and all that stuff, the digestive tract. So I've been peeing blood since December, and the frequency of the in the blood is picked up here. So I've been kind of wondering what's going on here. I want to make sure it was nothing serious. So the findings: non-contrast imaging of the urinary tract does demonstrate a 3 mm non-obstructing left lower pole calculus with additional punctate. 1 mm lower pole calculus as well. So basically, fancy words for there are some small kidney stones here. So there are one or two non-obstructing kidney stones in the right kidney, and there are two, or there's another kidney stone within the prostate, a 2 mm kidney. So that's within the prostatic urethra. So I think, what do we got here? We got a couple kidney stones, but the good news here. So let's just say it is kidney stones first of all. So I've got some small kidney stones, about 2 mm, all of them, which is good because kidney stones of that size tend to flush themselves out over time. Now, I've been peeing blood for literally 6 months, which is crazy, but I'm hoping we can get to the end of this soon. Just the other day, it was like 2 days ago, my urine was really bloody. So I feel like it's getting closer. I'm taking Chanca Piedra, and I'm taking uric or citric acid every single day to try to dissolve these and flush them out and prevent them moving forward. So this is a pretty good diagnosis. This is like best case scenario, which is probably what Eric Bugenhagen has as well. If I had to guess what his hematuria is from. Now the big news here: following contrast administration, renal parenchyma is unremarkable, without evidence of scarring, masses, or cyst formation. So the kidneys are in great shape. No scarring, no masses, no cysts. All those years of anabolics and my kidneys are in perfect shape. I'm pretty happy with that. Excretory imaging shows no suspicious I'm not even going to try to say it. Urethral abnormalities within the upper tract or bladder. So nothing weird going on in the upper tract or bladder. The GI tract's looking good. Other good news: the lungs are clear. This is good. I had pneumonia where I was coughing up blood a couple years ago when I was on tren. So that's really good. Um, Other solid organs are of the upper abdomen, including the liver, spleen, pancreas, and adrenals, are unremarkable. No bowel abnormalities or adenopathy appreciated. So lungs look good, kidneys look good, liver looks good, spleen looks good, pancreas looks good, and adrenals look good. That alone is worth doing the CT scan because obviously no pancreatic cancer, no liver cancer. Everything is in good shape. All my organs are normal size. This is fantastic news. So it's really the peace of mind from this is tremendous. It's worth all the money in the world just to have this peace of mind. Now this is the part I was talking about where I glanced over this at first, but this last part, look at this. Some increased opacification appearing changes involving the proximal femurs and anterior inferior iliac spine to the pelvis. What does that mean, guys? That means, if I could put this into words, my hips are kind of screwed up right now, which I've been saying. I cannot back squat, and low bar is even harder for me than high bar because my femurs jam into my pelvis. My femurs jam into my hip sockets, and I just can't get down properly. So low bar is even worse. High bar's the next worst, and then safety bar is not quite as bad. Front squats and safety bar aren't quite as bad. So I've actually been trying to squat with my heels propped up. I wear Olympic lifting shoes that already have a heel, and then I put plates underneath as well. So I have like the amount of ankle flexion. This allows me to get down without too many issues. But you can definitely feel stuff soften there. I've been doing that with the safety bar and front squats, and that's helped me be able to squat because I'm just squatting to help my deadlift. I'm not squatting to actually compete with squats because back squats aren't going to happen. And this right here shows exactly why. So I think what's going on here, I think there's some calcification with the femurs and the hip sockets, and everything's kind of calcifying together, which is why it feels like there's a lot of impingement and things are jamming. So that was interesting because that wasn't even what we were going for, but that shows what's going on with the hips. Conclusion: punctate nephrolithiasis. That's just a fancy word for kidney stones. They say the 2 millimeter kidney stone within the prostate is probably the contributing cause of the hematuria, peeing blood. So I'm just trying to flush it out. I'm really not going to do anything besides try to take natural supplements to flush it out and prevent this moving forward. But that's what's going on. Like I said, I'm still peeing blood rather frequently, which tells me the kidney stone is likely moving. Um, but it's not it's disconcerting when it happens when your blood when your urine is bright red. It's very disconcerting. So this gives me peace of mind to know I don't have cancer and I'm not dying and anything like that. So good news overall, guys. But appreciate you guys watching the video. And if you're interested in coaching, shoot me an email, prstrength1@gmail.com. Thank you for following along. I'm out, guys.